Hi all, welcome back to my channel. This is the fifth video in the discussion series of the Kerala PSC DHS Nursing Officer Grade 2 Examination Question Paper 2023. Thank you for watching and supporting the channel. So let us move to the 21st question. The patient has an order for 2 tablespoons of oral glycerin. How much medication does the nurse give? The options are 2 ml, 10 ml, 20 ml, 30 ml. So the correct answer is 30 ml. 1 tablespoon equal to 15 ml. So the question is 2 tablespoon of oral glycerin. So 2 into 15 ml equal to 30 ml. Now how much is 1 teaspoon? 1 teaspoon is 5 ml and 1 ounce is 30 ml. The next question is, a patient is admitted with the diagnosis of severe left-sided heart failure. Which adventitious lung sound is auscultated? The options are wheezes in the left lower lung, inspiratory crackles in lung basis, rhonchi mediastinum, crackles only in apex of the lungs. The correct answer is inspiratory crackles in lung basis. In severe left-sided heart failure, the left ventricle cannot pump blood effectively. This causes blood to back up into the pulmonary circulation, leading pulmonary congestion or pulmonary edema. Fluid accumulates first in the dependent part of the lungs, which are the lung bases. When the patient breathes in, the small airways and alveoli that are filled with the fluid pop open, producing fine inspiratory crackles. So in left-sided heart failure, what is happening? The fluid accumulates in the lung basis, which causes crackle sounds. Now we will go through the other options. Wheezes. What is wheezes? Wheezes are associated with the asthma, COPD, airway narrowing, not typical of heart failure. Then rhonchi midsternum. Rhonchi means secretions in larger airways. Midsternum is not the classic spot for congestive heart failure. Then the other option is crackle only in the apex of the lungs. The fluid accumulates in the base of the lungs, not in the apex. Apex is the upper part of the lung. That's why that option also not correct. The abnormal lung sounds are very important. So just read each lung sound and it can be seen in which condition. Stridor, high-pitched musical sound caused by upper airway obstruction. So in the upper airway obstruction, you can hear the sound of stridor. Second one is rhonchi. Rhonchi is the coarse rattling sound usually caused by secretions in the bronchial airways. The associated conditions are obstructed trachea, pneumonia, bronchitis. Wheezes. Wheezes, high-pitched whistling sound produced in the lower airways. The associated conditions are asthma, COPD and heart failure. Then crackles. Crackles are fine bubbling sound heard in the distal airways or alveoli. The associated conditions are pneumonia, heart failure, chronic bronchitis, asthma, COPD, pulmonary edema and pulmonary fibrosis. Next question, question number 23. Arterial blood gas levels pH 7.2, PaCO2 21 mmHg, PaO2 92 mmHg and bicarbonate -8 indicates. The options are metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. The correct answer is metabolic acidosis. So to find out the answer, you should know the normal ABG values. First one is pH. The normal value is 7.35 to 7.45. Then carbon dioxide, PaCO2. Normal value is 35 to 45 mmHg. Bicarbonate 22 to 26 milliequivalent per liter. Then oxygen, PaO2. Normal value is 80 to 100 mmHg. Then saturation, oxygen saturation is 95 to 100. So how to read an ABG? There are mainly two parts, respiratory and metabolic. Respiratory, you are checking mainly the carbon dioxide, and in metabolic, you are checking the bicarbonate level. So respiratory alkalosis means the bicarbonate will be lower than the normal value. And in acidosis, the carbon dioxide will be higher than the normal value, where the pH is high in alkalosis and low in acidosis. Then when you're checking the metabolic alkalosis, what you are seeing, which component? Bicarbonate. So in metabolic alkalosis, the bicarbonate will be high and the pH level also high. And in metabolic acidosis, the bicarbonate will be low and pH also low. So in our question, the pH is 7.2 means acidic. PaCO2, that is carbon dioxide 21 means that is normal. Then PaO2 is 92, that is oxygen level is normal. Then bicarbonate is 8 only. So here we can see the pH 7.2, that is acidic, and bicarbonate is less, that is also acidic. So bicarbonate we are checking for the metabolic side. So this is metabolic acidosis. Hope you understand. Next question, question number 24. Which of the following patient is greatest risk for the development of hypocalcemia? The options are 65-year-old with hypertension and asthma, 56-year-old with acute renal failure, 28-year-old with acute pancreatitis, 40-year-old with appendicitis. The correct answer is 28-year-old with acute pancreatitis. So the greatest risk for developing hypocalcemia is highest in acute pancreatitis. So in acute pancreatitis, pancreatic enzymes cause fat necrosis. Free fatty acids bind to calcium, causing a chemical reaction called saponification. This traps the calcium and leads to significant hypocalcemia. Severe hypocalcemia is a classic complication and a poor prognostic sign in acute pancreatitis. In renal failure also can cause hypocalcemia because kidneys cannot activate vitamin D and phosphate retention binds calcium. This is a risk but not high risk. The high risk is seen in acute pancreatitis. So the answer is acute pancreatitis. The last question in this session, 25th question. Vivid dreaming occurs during which sleep phase? The options are REM sleep, stage 1 NREM sleep, stage 4 NREM sleep, transition period. The correct answer is REM sleep. So the sleep has two main types, NREM and REM. NREM is non-rapid eye movement and REM is rapid eye movement. In NREM sleep, the non-rapid eye movement, which has three stages, stage 1, stage 2, stage 3 or 4. This is deep restorative sleep. Dreams are vague, not clear, thought-like and not easily recalled. But in REM sleep, rapid eye movement sleep, this is paradoxical sleep. What is paradoxical sleep? That is, the brain is very active and looks awake on the scans, but the body is deeply asleep and paralyzed. So the key features are, first one, vivid, detailed, story-like dreams. This is when most dreaming occurs. Then the other key feature is rapid eye movement under closed eyelids, and the muscle atony or paralysis. Body is relaxed to prevent acting out dreams. Irregular breathing will be there. The heart rate and brain activity similar to awake state. So our question was, vivid dreaming occurs during which sleep phase? So it is clearly given the key features of REM sleep is vivid, detailed, story-like dreams. So the answer is REM sleep. Thank you for watching. If any doubts, please ask in the comment section. Thank you.